and improving how we can predict outcome in patients who present to general practice with musculoskeletal pain, using an example from a shoulder pain study. So musculoskeletal pain accounts for around 14% of UK primary care consultations, representing a significant proportion of appointments. Patients tend to consult when pain is most severe, and it's not always clear whether this patient then requires immediate referral for further tests, or whether they simply require reassurance that the pain is not indicative of anything more sinister. In many cases, therefore, the patients are invited to reconsult, or may choose to reconsult themselves if the pain worsens or doesn't improve. However, in many prognostic studies, only measure prognostic factors at baseline, and this includes this monitoring over time, which may explain why many models are only moderately successful at predicting who is likely to recover. So to take account of this, we formulated a hypothetical clinical scenario where a patient presents to a GP with musculoskeletal pain. And at this first consultation, along with an assessment of their pain, more extensive baseline information is collected about that condition. And patients are allocated statistically to one of three groups based on the probability of recovery, either low, intermediate or high. And those in the intermediate category, those that we have the most uncertainty about, are invited to reconsults 4 to 6 weeks later where their pain is reassessed. And we wanted to look at whether monitoring patients could help to more accurately predict the pathway they require to help to improve their management. And we used data from existing cohort studies in shoulder pain to explore the added benefit of incorporating information from repeated assessments in this intermediate group to help predict their long-term outcomes. So this graph shows the people who are in the intermediate group at baseline and where they ended up when they reconsulted at 6 weeks. So we're focusing on the messy part of the graph here, so ignore the other elements. So all the patients were in the intermediate group, so this circle here to begin with. And by 6 weeks, some of those patients had shifted to the high probability of recovery group, so these patients are doing okay. Equally, some patients had moved down to the low probability of recovery group, so they need to be referred. This is all based on statistical probability. The other information this graph has is whether those patients actually reported recovery at 12 months. And you can see here that from the information presented in the dark blue circles, we can see that the model is quite good at predicting those who are likely to do well. Less likely, but still okay at predicting who is likely to not do so well. So it does help slightly with management, but more work is needed just to help. More work is needed and testing the model in other populations. Okay, so I'm within time. Yeah.
Nice to thank you, Gemma. So, any questions for Gemma? So can I start off? I think we often have models that predict people who are going to do well.
Yes.
But they're almost the group that are less interesting, aren't they? So how do you go about really identifying those people at risk of a poor outcome, who are the ones that clinically you want to perhaps identify and do something about earlier and really intervene in their treatment?
Well, I think this is what we're trying to work towards, really, isn't it, with this? So we have this particular example is based on a study where we already have who developed a prognostic model. And our prognostic models aren't necessarily great, as you say. They tend to predict people who are doing well and not those who are doing poorly. And we're hoping that by monitoring people over time and including some of this information, this might help identify those who are more likely who will worsen and aren't getting any better. So hopefully, while it won't happen immediately, we can't immediately decide who can go off, and within a short space of time we can hopefully pick out those people, identify them more clearly.
Got time for one more question? Thank you.
Before developing this model, what kind of search did you do for to look up existing model for the same problem? What you learned from those models? Okay, so this is this model is secondary analysis. So this model, this is based on a previously validated prediction model and prognostic model. So I can't be sure exactly what they did before. I'm sorry, but we can discuss that after.
Great. Thank you very much, Gemma.